My name is Kathy Brewer. I am a physical therapist at Mayo Clinic Hospital here in Arizona. I have a specialty in gerontology and over 3 decades of experience working with specifically older adults in the physical therapy world. A fall is a sudden, unintentional change of position to a lower level or surface. It doesn't have to be falling to the floor, fracture, bleeding. It doesn't have to be big and fancy. It needs to be recognized as a loss of balance or control of your body in space that was unintentional. So a slip, a trip, kind of landing in the chair hard, maybe catching yourself on the counter, those should be red flags that you're at risk for fall. There is good research to show us that individuals who may have had a fall even without injury begin to limit their activity because they're afraid of having a fall that might actually require some medical care or cause them to need some intervention. So they will limit their activity and stay away from those things that they're insecure about. When in fact, by limiting their activity, they're doing less, they lose strength, they lose that sense of balance in space and control of their coordination and their reflex behavior and so forth, and it makes them at higher risk for fall. So when we see people who have a fear of falling for any experience, any story they heard from their best friend or their sister who had a fall with injury, if they start limiting their activities, it can greatly increase their risk for fall. Physical activity practices the very skills we need that keeps us safe on our feet. The other part, in addition to physical activity, is making good choices. If we look at the environment around us and we see a potentially hazardous situation, we need to think twice about just doing things perhaps habitually as we might always have done them. So if you've always changed your own light bulbs, but gosh, that step stool isn't quite as stable as it used to be, or I'm not as stable as I used to be, perhaps I should wait and ask for help rather than just climb up on that stool, reach over my head, and put myself in a risky situation. If looking at that escalator makes you weak in the knees because you're just not sure about that motion under your feet, then find the elevator and take the elevator. Walking through a dark parking lot, if you're not sure what the terrain is, there may be potholes, there may be parking blocks that you need to step over. If you don't see them, if you're not really able to do that step over, then you shouldn't be there without some support or an arm to hang on to. Just take another way around. So making good choices is a lot about fall prevention. Recognizing hazards in your everyday environment, throw rugs, cords, clutter that we leave, reaching too high for that heavy frying pan on the top shelf that you hardly ever use. Those are things that we perhaps have always managed, but maybe today we need to take a second look at. Falling is important because it can, in an instant, change someone's life. If you have a few slips and trips, eventually you're going to have an incident that does significantly change your function, your safety, your ability to move about and perhaps be independent. So fall prevention is being aware of all of the issues that affect balance and the hazards in your environment. Any therapist can tell you books of stories about individuals who were very, very functional even into the 9th decade, but then there was that one throw rug that they tripped on, and that ended really their ability to function independently and do the things they enjoy doing.